right now with Dr. Hoa Nguyen, the now former chairman of the Governor's Physicians Advisory Group.
Right.
I was just curious how many times the good doctor has actually joined us on this program in the year and a half that we've been doing it. You want to take a wild guess?
58.
That's a good guess. Joe, sir? 60. Okay, Doc, you wanna muster a guess at how many times you have been on the show now?
20, 30 times?
Oh, way more than that.
This is Dr. Hoa Nguyen's 94th appearance on this show.
Wow.
Holy macaroni and cheesy. That's a lot.
Wow.
I talk too much.
Yeah. Well,
I
no,
talk
Doc.
too much. That's why I get in trouble.
Yeah.
Yeah.
Well,
so Doc, I know you've been stressed out over the past couple weeks about high numbers and everything like that, but that's one number that we really do appreciate.
Yeah,
so.
and I think it goes to show. I mean, he's been very accessible in coming on. I mean, that's about twice a week, I want to say.
Yeah, and I took a look at the data for that too. There have been times when he's been on the show like 3 and 4 times too.
Right. Yeah.
And in the last few weeks, he's actually been proactively reaching out to you to say, "Can you please tell your listeners?"
Yeah,
that
always.
You do what's right.
I mean, the messaging when it comes to the pandemic and what we got to do to be safe, we're all aboard. But unfortunately, a lot of times there's too much politics involved. Right, Doc?
Yes. Don't like politics.
Well, thanks for joining us. So let me get this straight. You resigned. Was it actually a few days ago, Doc?
I resigned over a few days ago. I guess during the weekend. But just a day or two after the EO, I guess. But I don't want the public to know. Just because I don't want to. Number one, don't want them to be distracted what we need to do to curb this surge. And number two, I got to give the courtesy to the governor's office to release it first.
And they did that, I think, late yesterday after noon, Doc. But just give us the reasons why.
Chris, like you guys know me. I've been volunteer for this thing now for since the beginning of the pandemic. To be the chair to PAC. And even when I go off island, my family keeps saying, "How come you don't turn your phone off? Because you need to get off your phone." That's just because this is my passion. My passion is to make sure that we have a good direction and good ways to move the island forward during this pandemic without affect our people's life very much. And I can tolerate a lot of error and mistake and things, but one thing that I do not tolerate, Chris, I have to stand by my principle is the freedom. That's to me, like I say to on Ray Gibson and Pat, is that freedom is what people die for, and my family is a refugee. I served 24 years in the Air Force, and I firmly believe that everyone have to have the freedom of choice. We can actually make some different way to curb the virus. Okay, I don't think that the division of vax and unvax and restriction that put in place in the EO will curb the surge at this point. I think they get people to be harder, take a harder stand where they are, and it's divide the community so much. So I think that we have to somehow, admit our mistake and go back and try to form a unity between the vax and unvax, because we're going to need every one of them to help curb this surge. So I think that we have to change direction really quick, because 120, 140, it will go higher if we don't, if we don't be careful how we approach in the next week or 2 weeks.
So basically that was the straw that broke the camel's back when you provided the recommendations to the governor, and boom, the press conference happened on Friday, and it was nothing that the PAG recommended.
Yeah, Sabrina, it doesn't matter what restrictions out there that the government decide to do, but I think that to mandate private company and restrict the unvaccinated people from their activity, their normal daily life, to me, you really violate the right of the people, and it's not the right way to control the surge, and that's the space we out of. It's a reactive way, and it's you have to plan way ahead of time, in the manner that you don't have to react to this to this surge in the last minute. You have to plan ahead of time.
Yeah.
Is there planning going on up there at Adelup?
I think they should have a lot of plan, depending on who's the governor will pay attention to. Again, I'm strongly believe after 18 or so months on this thing is that it's a health emergency. The physician advisory group, the purely their heart is in the right way. They volunteer that time and give up a lot of their time to practice and their family. And I tell you, it's a health emergency. No one knows best than the physician-driven. Big action to help to try to control this virus, and you cannot control or make decisions by not working on the ground. So if you sit in the office and you make decision and without taking recommendation for people that see sick patient every day, we're gonna eventually will recover, but it's gonna take a lot of time, a much longer time, and there's a lot of casualty before this virus is going to decide to go away. And then we have to deal again with the next surge. I'm sure that COVID-19 will mutate and will give us more headache in the next year or so before we can find a cure for the virus.
Doc, you say it's going to get worse. We're at 147 positives last night. Hospitalizations up to 32.7 in the ICU. Public health, from what we hear, Doc, public health overwhelmed with contact tracing, testing. We're seeing it. We just got a message this morning from a guy who showed up early. He said, "Hey, I got to show up early to get tested because everyone's going to get tested." He shows up early. There's already 30 cars in front of him. So
Yes.
There's got to be some kind of pivot with just if we could just kind of address public health, because I know you've had your issues with them. We had a caller yesterday that called up to talk about how she felt she wasn't contacted in a timely manner for contact tracing, and Chima kind of just went off on her.
Yeah, that's the key here, is that we have to be telling the truth to the governor. We don't want to say things that she wants to hear. We need to say things that in reality. And, we as the people that work every day and see and hear our patient, they are probably, I'm guessing right now, we are about up to 4 or 5 days behind now in contact tracing and isolation. And that's a huge risk for our community. And the surge is that, when you have a positive and you contact the positive, you just need to have a medical trained registered nurse or physician to contact the positive, because you have to tell them what to do next, right? You have to interview them. You have to see if they have a risk factor or not. You need to see if they have a candidate for the monoclonal antibody treatment to try to keep them away from the hospital. A lot of my patients were saying, hey, they call, say you positive, but that's it. There's what number that I call, I don't know. What I do next, I don't know. So we have to have a much better way to communicate and let the people know right away. And I feel for the caller yesterday, and she really called in to really give her input for public health to make improvement, right? I mean, she don't call in for no reason, but for us to kind of ignore her or blame back on her on not staying home and all that kind of stuff, you can't do that. She's one of the person that's positive, and she just tried to reach out for you to help. And you have to be sensitive. You have to be open-minded. You have to kind of listen to her concern, because she's one of them, and there's many more out there on the same boat. So that's something that it's never a shame to admit that you're overwhelmed. It's never a shame to ask for more help, because remember, we are in the same direction. We are trying to get our life back to normal, and we are trying to tell you, make some adjustment. So I think that you need to take criticism as constructive rather than shut the door on people on the criticism. And that's the only way that we can improve ourselves, as be a big person and take criticism as I need to do better.
I wanted to follow up, Doc, on what you mentioned. You mentioned that we need to tell the governor what's really happening and not what she wants to hear. Well, you did that.
Yes.
And she didn't take your recommendation. She didn't take the PAG's recommendations. What is going on? What kind of political interference are we looking at in managing a pandemic when lives are on the line?
The governor have a lot of decision, and she had a lot of input from other people, and a lot of different level to give input. But I think the challenge for her is she need to pick the right group to listen to, and that's the thing. And that's the key. And again, I keep saying this is a health emergency, and you have a lot of physicians in this group, and they are the pulse of the community. They know what's going on in the community. You have to listen to the PAC. They are your key number. No, like I say, this surge will eventually get over. It just depends on how long it's going to take and how much casualty you're going to have. But the best way to get there much faster with much less casualty is your physician group. Now, I tell you, it's a healthcare emergency. It's a healthcare issue, and the best person to at the helm is the physician as a group. I respect Chima, I respect Art, I respect everyone, but none of them are physicians. And they have to pay attention to. Remember, we don't fight with each other. We are on the same team, and that's the message I want to keep saying every day, is that we need to put the difference aside and fight as one team. And that's the only way that we can shorten up this surge very quick, and not much of the people that are dying. And I really ask the governor and really consider it's not a disrespect for the governor, but again, the physician, we have our own way. We will speak because it's our integrity and that's our profession. We will continue to speak because we don't play politics. We just speak for the people of Guam, and we want to do things to help the people of Guam and moving forward to this pandemic. We're not even halfway yet. We are climbing the hill still.
Mm-hmm. But Doc, you said, Art St. Augustine, he's not a doctor. For goodness sakes, he ran the senior Citizens Manumco branch for public health for years. Chima, he's the chief public health officer, but you do have a doctor over at public health, and that is Dr. Felix Cabrera.
Yeah, Dr. Felix Cabrera is really a very academic person. Mm-hmm. I think that the experience on the clinical side I think that he would be behind on a lot of physicians on the advisory group because there's a lot of physicians advisory group have 20 years plus of practice, and and they are in the community. They FSP, SDA, these are people that see patient every day, and we have different level of physician. And Felix is wonderful on data. He present data you can see, but that's again mostly is really behind the paper and not really at the boot in the ground, right? I don't think that I see COVID patient the next day, the one day, the next day they pass away. So you're really on the boot in the ground and you see what's going on. So I do the testing. I know how fast it is. I'm at the site. So when you have people, a physician or something that mostly at the admit level, you have to listen to people that are on the ground. That's the thing is that in order for public health to move forward, really listen to your PAC and take the PAC direction, but they don't fight you. They are on your side and they are your team. So but better communication should be within them. But like I said, the governor have a lot of people telling her what to do, but she really have to trust the physician advisory group. They are all volunteer. They're not paying. They don't get one single penny, but they are volunteer that time for one purpose is because they want Guam to get better.
Right, Doc. And, it is a little concerning because, like you said, the PAG, they're volunteers. They provide advice to the governor during this pandemic, a medical emergency. If she's not listening to the PAG, and I'm not saying Dr. You, I'm talking about all of you, the PAG, not listening to the business community. The Chamber of Commerce wants this EO, refined EO, rescinded still. The Chamber, GHRA, didn't know about this, but they've made their recommendations as well. You mentioned in previous interviews that the Surgeon Cell also supported the PAG's initial recommendations. So who is advising the governor?
I'm not quite sure. I tell you, after 15, 16 months on this one, I'm still scratching my head. I'm not quite sure. I know she take a lot of decisions. Recommendation for different group, but I'm not quite sure who had the final saying on this thing. I'm not quite sure, but to put things in the past to move forward, I think that the best way is I really recommend the governor to basically really listen to Dr. Mike Cruz. He really know what he's doing and listen to whoever the next chairperson for the PAC, because they are, like I say, the search will go over. It depends how long and how we get there. But I think the best way to get there is listen to your medical advisory group, because it will take the shortest way for the whole island to move forward, to minimize the casualty and minimize the number of the people that turn positive out there. But remember, everyone that turned positive, guys, there's at least 2 or 3 more people in the community there that are positive that have not been tested yet that will walk around and transmit the virus. So really, we have to get control really quick before it spin out of control, which is spinning right now. So that's something that we have to be very, very careful. And the other one, and I really need again, the message had to be across. You got to somehow stop the division of vax and unvax. Guys, the data show that you shouldn't make the division at this point, just because we should send the message to let people know that, again, re-educate them that we support immunization is really to decrease the hospitalization, right? Because that's the lifeline of Guam is hospital. You only have 2, GMH and GRMC, and the Navy Hospital. The Navy Hospital is 3. So, but the main part about immunization is decrease hospitalization and decrease the risk of people dying. But it doesn't mean that the fully vaccinated won't transmit. From what we see in our clinic, is about 20-25% of fully vaccinated that come in with mild symptom and they test positive. And remember, when they do that, they are fully transmissible the virus to someone else. So we have to make sure that the message come out clearly that we need to protect both the unvaxxed and the vaxxed, because they both can transmit. It's just that the unvaccinated people will have a higher risk of hospitalization and complications. So if we open a restaurant, or we cannot get, expect the unvaccinated to not be able to do anything, because it's not fair. They are people too. They are people that live on the island, and they need to go wherever they do, but just advise both the vax and unvaxxed to be mindful and be careful, because each one of them will determine how we're going to curve this surge right here. So unify them, unity, put them together in one group and do not divide them. And that's the thing that, enough division, too much hatred that we build, and that is not right.
Doc, division, separation, at your clinic, have you ever had to experience a situation where someone felt that, I'm forced to do this, I don't want to get the vaccine, but I have to, and if you did, how did that make you feel?
We see every day, I tell you, and the people that on the borderline, they are hard borderline. They will make their stand, and I can tell you from the boot on the ground, is that yes, people are forced to go get vaccinated, and they're gonna get one shot, and they will not come back for the second one because they meet the criteria already. That's the bad part that we don't think about. When we force people to do things, they're going to say, okay, I'm going to meet the minimum, which is one shot. Now I can do everything I want to do, and I won't get the second one. And that's the story that I hear on my clinic every day. I have a young adult, which is less than 17, I'm 16, 17, but they have a golf tournament. And they don't want to be vaccinated, but now they come in, they get one shot of J&J, which they really hated, just to be able to play in the sport. It's really hard that you don't see that when you force people like that, is the 16, 17-year-old will stuck in their mind that, hey, I do things I don't like to do because I got forced to do, and that translates to how they see the future of Guam and the future in the United States, that, hey, we don't have our freedom anymore. So it's really, it's not the purpose of what we do at this point. Is but we keep dividing people, is not going to be healthy. And again, what I hear from my patient, they're going to get one shot just to say they got a shot, and they won't come back for a second one. So we need to pass a message somehow that we need to convince the people to complete the full vaccination, because it's not because vax or unvax, it's because it decreases your risk of being in the hospital, and that's what we want to do. And that's all it is. So we have to be in the same group.
Yeah, Doc, so let me ask you, right, if you as the head of the former head of the Physicians Advisory Group are saying that focusing on the vax and the unvax is not stopping the spread of the virus, then what do we need to do to stop the spread of the virus right now? Because we're in week
right
4
now,
of this surge. It's crazy.
As we suggested before, you got to cut down the number of gathering to 10, 20, 25, but you need to cut it down really quick, like today. And we need to be able to provide testing for people as quick as possible, and isolate the positive right away. That's again a strategic testing plan that I suggest, is that don't use the PCR. Every day that I read the newspaper, PCR only at the fairground, it gave me heartburn because people make the decision is not physician. And I tell you, you wait 24, 36 hours before you can notify the positive. They not staying home. They're gonna go out and have breakfast, lunch, and dinner while they're waiting for the result to be called into them. And that's what the caller yesterday was asking. You know, I mean, there's you have the ability to do the Abbott testing, not the Binax, not the antigen. The Abbott ID is very sensitive. It's accepted across the world everywhere as a valid test for people to travel. Yeah. United used that from San Francisco to fly to Hawaii. Japan accept that. It's very sensitive as a PCR, and you can find out the positive in 1 to 2 minutes. So 1 to 2 minutes against 24, 36 hours, there's a lot of time to curve this surge because you will let people know right away. And people on this island is very good. Once they know they're positive, they do stay at home. But you wait 24 hours, it's too late already because the transmission have been going on everywhere. So that's what I would do as to curb the surge right now. Those two things, you know, maybe protect the restaurant down to 50% occupancy, but don't separate no vax and unvax. And there's no data on that one.
Doc, stand by. Yeah. I'm sorry, Doc. Stand by real quick. Let's go jump on KUAM TV so we can put your hands and face all over the island. Good morning, Guam. Right on. We're back. This is The Link, Thursday, August 26, 2021. IKUAM TV. We're on live with the man who had a big part in guiding us through this pandemic. Yeah. But he has since resigned as the chair of the Physicians Advisory Group, Dr. Hoa Nguyen.
Yeah, Dr. Ho, thank you so much for your honesty and, you know, talking about what we need to do to contain the spread. Yesterday, 3 weeks ago, today.
4 weeks ago.
What the hell?
Yeah.
But, you know, people are going to miss you. We already miss you. It doesn't mean, though, that you're not still going to be out here on the front lines, right? Helping this fight.
Sabrina, I still take up the fight in the private capacity. And, you know, but I'm not going anywhere. This is my home. You know, and everything we do is for this island. You know, like I said, we're going to stand up a lot more immunization clinic for people that want the vaccine. And I will continue to speak out for the people and make sure that they have the right info. And also, you know, I'm going to try my best if GDOE would ask for or would like for my help, is go in there and then basically standardize the protocol for them to make sure that they know what to do when they have a positive, you know, how long the quarantine, how long the test. They need to have some type of flow chart that's standardized to give into each school so they all are working at the same, so they just pull out the sheet and follow that. So right now, is I think everyone on their own, and it's really confused for the parents. And it's not GDOE fault, you know, it's a communication with multiple agency and the parents, the student are at loss right there. And it built a lot of confusion for them. But I think we need to really take in there, they need to have a physician that kind of advise them. I think that to me, I would be glad to help John and to do that. But I think that the kids need to be in school. I think they lost 1 year already. They don't learn much online. So I think that they had to be in school, and we need to make sure that the school environment, which they are safe for them, which the DOD did a lot of things to make sure that the students are safe. So that's one of my goals. Now I have a lot of free time. I will pick up a new chapter and move forward in the different capacities. I'm not going anywhere.
Right on, Doc. Well, we did get a comment here. Please continue to come on the link for updates. So if you are cool, we'll have you. I don't know. We never got Mike Cruz. Did we ever get Dr. Mike? Yeah, I don't know.
Yeah, that's right. We are hearing, according to Crystal, that he will be convening the PAG. I don't know if that means chairing, because they're very crafty with their words.
Yeah.
So,
Well,
Yeah, here's
and Doc, just so you know, because of course you're joining on your phone right now. Speaking of comments, there's an overwhelming number of comments that are thanking you for your work, for your candor, and for just saying, you know, for being part of the fight. And everybody says, you know, we know you're still in it. So the community is very appreciative of your work.
Yeah, I'm still here. I think majority of people know, and you're like, again, you know, take a lot of time, like I say, about 20, 30 hours a week just to be a chair. So I think that physicians out there, they volunteer their time, but very hard to have someone commit that time away from their practice and their family to do that. You know, but we all, the physician advisory group, we all love this island, and you know, I will continue to give them input because I know all of them, and they really are very good colleagues, and they all have the same goals I am. So we continue to communicate with them and try to suggest things to the governor to make sure that we make this fight as short as possible.
well, thank
Okay.
you. Thank you
thank
so
you for your
much,
service.
Dr. Hoa.
Okay, guys.
All right.
Take care and
Take
be
care.
safe. Talk to you guys later.
Don't
All
be a
right.
stranger. Hey, remember, we still got to go fishing.
Okay.
You're not getting
I
off
take
the
care
hook with
any
that one, dog.
Sunday. Okay.
No
I can
pun
fish
intended.
now.
Okay, good.
There you go.
Okay. Well, good morning. Too much politics. Not listening to the advice of the medical professionals. Too little, too late. Should have done something weeks back. Governor needs to hear the reality, not what she wants to hear. Those are some of the takeaways from that interview. We did have some comments on here. Thank you, Dr. Nguyen. I respect and agree with your expert opinion. I've listened to Dr. Cabrera when he appears on the show, and I agree he may academically be sound but lacking the clinical experience. As they say, he's still wet behind the ears. His opinions and advice resoundingly political to please the governor and not the people of Guam. Ouch. He likes to hear himself speak and comes across as arrogant just because he has a title. Pat Saho, we appreciate all you do for us, Doc. Rosemary Seguenza, Sendonkuluna Sidus Maasi, everyone, you're all very much appreciated. We're all one. Much love. Never writes in, a doctor for the people. Clarissa Torres, God bless. Olympia, thank you, Doc. Yeah, there's just an overwhelming amount of comments. I think Mary Rhodes had commented in here as well. Yeah, I mean, he's been with us a lot of times when Adelup wouldn't be with us.
And
Refused. And so he's been a source of information, very valuable.
When I first heard he was in charge of the PAG over a year ago, right?
Yeah.
I felt so good about it because in my experiences with Dr. Nguyen, when he was leading the Guam Medical Association medical mission to the Philippines after they had the big super typhoon years ago, he was the main guy at the top leading the logistics. He was first on the ground before, you know, the GMA team got there and the media that went along, and very professional. He had everything planned down to a T. And even, you know, Dr. Cabrera was actually part of that medical mission.
Yeah.
And it was amazing to see him leading this whole thing. Dr. Shea was part of it. Dr. Eusebio was
And if
part of it.
people have the pleasure
many
of knowing,
physicians.
yeah, if people have the pleasure of knowing Dr. Nguyen, that should come as no surprise because you know he alluded to his 24 years of service in the Air Force. He is a decorated lieutenant colonel. He is a medical officer that served for a very long time. And you know, I've been to AMC, his clinic, a couple times, and I've even talked to like some of the nurses and everything like that, and they're like, "Oh yeah, you know, Doc said, you know, he might come out," and I was like, you know, how is it working for him and everything? Because you know, we love having him on the show, and she said, I've worked with a guy for like 18 years. I've never seen him get frustrated, even like if he's under stress. He never takes it out on the staff. His character is very professional all the way through, and you know,
I kind of see what he's saying about boots on the ground, right, or Crocs on the ground, or whatever these doctors are wearing nowadays.
He can say booze because he was in the military.
Yeah, so and I get it, like with Dr. Cabrera, right? I mean, the biggest contribution he's made is the CAR score. But what use is the CAR score if we don't even pay attention to it anymore? We're not even paying attention to this CAR score. It's 23.4. That ought to mean something. But it doesn't, because it's a cooked up number. So what's the point of cooking up this number that we're supposed to be guided by when we're just going to ignore it now? When we're just going to ignore these hundreds of positive cases?
Because a year ago, we didn't have the vaccine.
Yeah, but as Doc said, and the stats show, they're vaccinated people in the hospital. I mean, unvaccinated people in the hospital too, but the spread is coming from both the vaccinated and the unvaccinated. So that's why we got to do the measures that don't discriminate. I don't even care this discrimination thing. We just need to do, all of us need to do things together that work. You know
who else was in the comments?
Stay home, wash your hands, wear your mask, all the basic stuff that stops the positive cases. Because this is just, I mean, he's saying it's going to get worse.
Also in the comments, giving his due praise to Dr. Nguyen was Adonis Mendiola, who organized that protest last week, calling for, can we not have this division, and, calling for, for
Yeah,
choice.
that was dumb, though, because he compared it to the Jews, which was absolutely ridiculous. That's stupid. It is. It's stupid to compare this to the Holocaust. Anyway, it's 8:15. You ready?
Yeah.
Yeah, let's go ahead and get into the news now. Yes, we are. Brought to you by Pacific Points with the very latest from the KUAM News team. Sabrina Salas Matanani, good morning.